Hello, everyone. So this is about the KAT6A, KAT6B patient registry. I'll go through the slides that Dr. Sharma prepared. Uh, so here we have the core features that are in the KAT6A gene, such as intellectual disability, speech delay, microcephaly, cardiac anomalies, gastrointestinal complication, genotype-phenotype correlation show that late truncating pathogenic variant exon 16 to 17 are significantly more prevalent. Known case so far 447. Mutation are reported throughout the genes and variable phenotype occurrence and penetrance. Late truncating mutation in exon 16 to 17 result in more severe phenotype. So the core features, there are neurodevelopmental defect, global developmental delay, gastrointestinal defect, cardiac anomalies, muscular defect, immune defect, sleep disorders. KAT6B gene, it falls in the same family as KAT6A, chromosome 10. Known cases so far 129. And mutation reported through most of the gene, variable phenotype occurrence and penetrance. Mutation in exon 18, most severe phenotype, core features, distinct craniofacial features, neurodevelopmental defect, genitourinary and renal abnormalities, cardiovascular anomalies, musculoskeletal defects. So the KAT6A, KAT6B registry was launched in 2019, hosted by the NORD, National Organization of Rare Disease. It's on a secure cloud-based platform, and it's compliant with US health information privacy laws and FDA regulation. The KAT6B patient part of the registry since 2022. Our goals are to serve as a database to enhance understanding of the full range of KAT6 related disorder, disseminate information quickly and securely to researcher and clinician, and enable researchers to identify trends that can generate new insight and identify areas of additional study. Guide the development of standard of care and expedite the completion of KAT6 clinical trials. There are currently 12 surveys under the KAT6A, KAT6B patient registry. 6 of the 12 surveys take 5 minutes or less to fill out. So the surveys are like getting started, type of mutation, genetic report, date of birth and the sex, diagnosis, date of diagnosis, test performed, publication, participation history, birth and family history, birth weight, head circumference, fetal abnormalities, fertility treatments, medical issues at birth, family history, neurological, seizure history, neuromuscular weakness, developmental and language milestones, neurodevelopmental condition, ADD, ADHD, immune system, allergies, vaccination, metabolic, mitochondrial abnormalities, autoimmune condition, and other condition, heart, thyroid, digestive, respiratory, pulmonary, kidney, bladder issues, hospitalization, sleep, vision, hearing issues, distinctive physical features. Medical history, weight, height, vaccine record, doctor visit records, treatment, medication, surgery, therapies, physical, speech and occupational research, participation history, medical record, genetic medical record upload, if any, socio-demographic information, county of residence, education, racial designation, pediatric quality of life, part 1, hearing, feeding, vision, mobility, communication, physical health function, pediatric quality of life, part 2, behavioral anxiety, depression, peer relationship. So a suggestion is to have the information below handy when you sit down to fill out the patient registry. Medical records, MRI, EEG test, hospitalization, genetic diagnosis, upload document or write the diagnosis, any medication and supplements used, amount usage, purpose of them, information on hospitalization, information on all the current health issues, information on current therapy programs. The current patient enrollment status in the KAT6A, KAT6B patient registry. So we have 417 registered and 271 consented and 200 started survey and completed 186. So 44% of patients who have enrolled in the registry have completed registry survey. We could do better here. Like if we can get up to like 80% or 90%. Total registration increase in 1 year, we had 32%. From April 2023, we had 317 till June 2024, 417. So we had an increase of 100 registrant. Total number of KAT6A and KAT6B cases known worldwide versus patients who have filled out the registry survey. So we have 447 KAT6A known. In the registry, we have 168. While KAT6B, we have 186, but in the registry, we have 25. This represent KAT6A, KAT6B patient known cases by country. So as you can see, in the Americas, we have 146 in the United States. Then it goes down to Canada, 21, Brazil, 7, Mexico, 4. In Europe, we have like in the Netherlands, 15, UK, 32, Spain, 19, France, 16. We also have patient in Asia. In China, we have 24. In India, 3. In Australia, 20. Entry of patient information in registry allows for identification of new trend. KAT6A data below. 40% patient spent time in the NICU when they were born. The issues at birth: hypotonia, respiratory problem, microcephaly. 31% claim no issues. And we have 78%, they have a global developmental delay, 19% classified as autistic, 11% with sensory processing, and 7% auditory processing. 80% of patients have an infectious laugh, and 64% have high pain tolerance. Patient male-female ratio is about 50%. So please take your time to fill out the patient registry. How to request access to de-identified data in the patient registry. You could email cat6aregistry@gmail.com. Fill out the Cat6 registry data access request form where you will lay out a brief outline of your research proposal. The Cat6 Foundation registry team will review the request form for access to de-identified patient data. All procedure will be in agreement with the standards set by NORD and the Institutional Review Board. Future direction: publish registry data finding in a scientific journal. Autism spectrum disorder in KAT6A and KAT6B patients, study led by researcher at William James College, Massachusetts, and Chicago School of Professional Psychology. Mortality Review Committee studying KAT6A and KAT6B patient mortality reports in depth, including autopsy reports to better understand manifestation of KAT6 disorder in the disease. And this will end the presentation. Do you have any question? What's the question? Okay, thank you very much.
Thanks, Emil. I just want to emphasize again regarding the patient